This is Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.
Hello and thanks for joining us. I'm Barry Morgan. On this edition of Your Health, we explore palliative care. What exactly is palliative care? What is done for the patient? To help answer those questions and more, we have with us Dr. Bernard Lapointe, Chief of Palliative Services at the Jewish General Hospital and for the Centre-Ouest Central Montreal. Dr. Lapointe, first of all, thanks for joining us.
It's a pleasure, Mr. Morgan, and good afternoon or good evening, everyone.
How do you define palliative care, first of all?
Well, palliative care is the set of interventions that are aiming at the quality of life. So it is destined for patients with catastrophic illnesses, so illnesses that are life-threatening and that are really attacking the quality of their life in terms of pain, in terms of shortness of breath, in terms of nausea, or it really impact the quality of their social life and the quality of their family life. For instance, you're depressed because you cannot earn the money that secured financially your family. So it's all the it's all the support services and all the care services that are aiming at not prolonging your life, not curing the disease, but aiming at helping you live better with the disease you have. This being said, there's no conflict between working and aiming at a cure or prolonging life and quality of life. They go hand in hand.
Sure.
But the supportive care team and palliative care team are the expert of the quality of life.
I understand, and there's an entire team involved.
Yes, obviously we have the physicians, the nurses, the social workers, the physiotherapists. We have the musical therapists, we have an art therapist, we have volunteers, we have massage therapists, we have pet therapy. So we are offering a wide spectrum of care and interventions depending on the needs. So we have all kinds of setting as well and access to palliative and supportive care. Very often people think, oh, palliative care is for the end of life.
Right.
But you know what? Palliative care is very often accessed early during the disease trajectory.
In other words, palliative care is not only for end-of-life situations.
No, we can. At that point, we'll talk more about supportive care, but really, you don't need to be dying to have relief of your pain.
Well, that's very good to know.
And that's very important to know. So people who just been diagnosed with a cancer or another life-threatening illness and have a lot of symptoms will be able to be referred to palliative care. Obviously, there's a point during the disease process when the illness is life-threatening that cure is not possible anymore and that treatments are becoming more and more difficult or impossible to receive. So at that point, there's always something to be done, and this is where the end-of-life care kicks in. And this is where we will try to organize home care, palliative home care, and we have at the CIUS expert teams that go at home, physicians, nurses, social workers. We have beds, palliative care units in both Mount Sinai Hospital and at the Jewish. And we have consultation, liaison, so the expertise of palliative care is available in our long-term care facilities, as well as everywhere in the hospital here at the GJH or at Mount Sinai.
So, doctor, what is actually done for the patient once they're under your supervision or anybody else's when it comes to palliative care?
Well, we're looking at like the quality of life. We're looking at what, are you sleeping well? Do you have pain? Are you short of breath? What's your appetite? Can we help on these things? And we've learned over the last 40 years how to care for these people. We offer support to the family because very often you're not alone to live with, let's say, cancer. You're not alone to live with cancer. Your wife or your husband, your brother or your sister, your family caregiver live with cancer, and very often will experience a lot of distress, depression, and they need the support. So palliative care will offer that kind of support, and we're very, very blessed to have hundreds of volunteers who are helping us, and not only up to the moment of death, but as well after, during the bereavement period. And this is one of the service that is like very helpful for family members.
Can you maybe talk a little bit more about that?
Usually you see when death happens, the family is or your friends are there for the first month, they're all there. But 2-3 months later, everyone expects that you turn the page. But this is the time where you feel the most depressed and the most pain. And this is when our volunteers will call you and invite you to come to, we have like sessions, like weekly sessions, drop in, where it's a therapeutic group. We have even a walk on the mountain every week, where people come to a rendezvous point and a meeting point, and then you walk. All you have to say is the name of the departed person that you cared for, and then you can walk in silence, or you can talk walking on the mountain, and everything finish on the top of the mountain at the chalet, and you're having a coffee or hot chocolate.
So there's people there who are volunteers, as
Yes.
well as others who
Exactly.
are mourning their loved ones.
Exactly, and the goal of this is to help people share and break their isolation, and this is part of the services we are offering.
Very difficult, let's face it, nevertheless, to at least have that opportunity to be with others. I would imagine that would be of great comfort.
It is of great comfort, as well as the fact that we're really trying to meet the expectation of the patient and the family for where the care is going to be organized or delivered. So most people would wish to die at home. So we're really aiming to help and allow this. And truly we've organized our services to really allow for this. And what happens in vast majority is that people are able to stay at home almost till the end. And when it's not possible anymore, then they can access a bed. But when they come to the hospital, it's for a very short period of time.
I think you mentioned palliative home care.
Yes.
As well as units within the hospital.
Mm-hmm. So very often, people will stay as long as possible at home, followed by palliative home care services from the CLSC, and you can access those asking your physician to call the CLSC, the home care services, and ask for home palliative care.
That's the best way for access. Speak to your physician.
Speak to your physician, or speak to your pivot nurse, your nurse responsible for your care in the hospital, and they will orient you, and they will refer you.
Just quickly summing up, Doctor, in terms of how palliative care has evolved over the years.
Mm-hmm. Well, I think at the origin it was really limited to the care of the dying, but we've learned. But the question was: do you have to be dying to be relieved of your pain and other symptoms? Do you have to be dying to receive the support you need? And I think the answer is evident, and that's how palliative care changed through the years. So we just broadened and offered earlier the services. And again, we don't do the equation. We care, in palliative care, we don't care for the dying. We care for the living. And the living are living till their last breath. And that is the most important for us.
Doctor, I thank you very much for your time.
It was a pleasure.
Dr. Bernard Lapointe, thank you again very much for your time and your expertise. Dr. Lapointe is Chief of Palliative Services at the Jewish General Hospital and for the Centre-Ouest Central Montreal. That's it for this edition of Your Health. Thank you for joining us. To hear our previous programs, you can find them at podcast.ciuswestcentral.ca. That's podcast.ciusswestcentral.ca. And let us know if there's a topic you would like us to explore in the future. I'm Barry Morgan. Until next time.
You've been listening to Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.